the primary function of ketone being a fuel, a preferred fuel for your brain, that really stands when it comes to cognitive benefit, because you can feel the subjective difference. In a study 2 years ago, they looked at brain network stability, and the way they looked at brain network stability is essentially the interaction between brain regions measured by functional MRI. For the exogenous ketone and the keto diet, they both saw an increase in brain network stability. So your regions, the different regions in the brain are talking to each other more versus placebo. And that's huge, because as we age, that brain network stability decreases, and that increases the risk of developing neurodegenerative diseases such as dementia and Alzheimer's.
Collective Insights is a voyage through topics and technologies revolutionizing human well-being. Groundbreaking approaches for a better world and a better life await you. Welcome to Collective Insights.
Hi, I'm Dr. Dan Stickler. Before we get into today's episode, I want to talk to you about a protocol that I'm passionate about that I use in my practice. You know, everyone wants to slow down aging, but few are really doing it the right way. There's something I do recommend for my clients doing just 2 days a month. It's a bodily cleanse that helps get rid of old defective cells. These are sometimes called senescent cells or referred to as zombie cells, and they are shown to be related to so many symptoms of poor aging. This bodily cleanse is a supplement which contains a group of ingredients called senolytics. Senolytic ingredients help our body to flush senescent cells, helping with easier repair and rejuvenation from muscles to joints to how we feel every day. Qualia Senolytic is the bodily cleanse supplement taken just 2 days a month for healthy aging that you have to try. Now, research on aging and longevity, including a beta study on Qualia Senolytic, shows that senolytic supplementation can play a huge role in enhancing how we age. Now, to learn more about senolytic research and to try Qualia Senolytic risk-free for 100 days, go to neurohacker.com, use the code PODCAST, that's PODCAST, for a free gift with purchase. That's Qualia Senolytic for better aging at neurohacker.com. Welcome back to Collective Insights podcast. I'm your host, Dr. Dan Stickler, the medical director here at Neurohacker Collective. And today we have a truly special episode lined up for you, diving deep into the fascinating world of ketones and metabolic health. Our guest today is Dr. Latt Mansor, research lead at H.V.M.N. Health via Modern Nutrition is what that stands for, a performance nutrition and metabolic health company. Dr. Mansor holds a PhD in physiology, anatomy, and genetics from the University of Oxford and consults with elite athletes, military personnel, and various clinical and research organizations. Latt, welcome to the show.
Thank you very much for having me.
Yeah, it's exciting to have this because I use a lot of actually the H.V.M.N. ketones with my clients, working with them in health optimization and longevity, and I use it in various ways. But let's start off with really getting an overview of what ketones are.
Sure. So, a lot of people hear ketones, they either think of the keto diet, which, they're not that far off, but the keto diet is specifically referring to a diet where you severely restrict your carbohydrate, in which your body starts to break down the fat and producing ketones in your liver. Ketone in and of itself as a molecule is not a particularly new molecule. It is not a novel drug that we suddenly come across these days that are solving all these different issues in health. It is indeed a molecule that has been around for as long as the organisms which can metabolize fat, back in the days. The reason why we produce ketone is also due to the fact that we used to have fed and fasted state, right? And because we don't have storage system, we have to go out and hunt for food. When we run out of food, that period of fasting put us in a state where we need to utilize ketones. Because we are low on sugar, our brain uses primarily sugar. Fats cannot bypass the blood-brain barrier. Therefore, there is no form of fuel to be shuttled to the brain for energy. So because of that, the fats have to be broken down into smaller molecules, i.e. ketones in the liver, and ketones then can bypass the blood-brain barrier and produce energy for the brain. That was the initial understanding of what ketones are. It's essentially just a form of fuel, or even a form of side product or byproduct of metabolism. But then over the years, over the past, I think, 20 years, we started to learn more and more about ketones, both endogenous, which is the ketones that we produce internally, and exogenous ketones, which are the ketones that we consume externally to increase our blood ketone levels. The three main ketone bodies that we produce are acetoacetate, acetone, and beta hydroxybutyrate. Beta hydroxybutyrate, or BHB to be short, is the main form of ketones, the main form of ketone that our bodies use to metabolize for energy, as well as circulate around the body. So whenever we measure blood ketone levels, that's measuring blood BHB levels. And this is especially important because BHB is now known to, one, increase sort of brain activity because it provides energy directly to the brain, and two, it has a signaling effect on the DNA level, and they call beta hydroxybutyrylation, which is similar to like methylation and all of that, on a DNA level to turn on and off certain genes that are related to metabolic health. And that area is still very early on in terms of research, and we're really looking forward to finding out what other effects that ketones have on the signaling side of things. But on the energetic side of things, now we know with the emergence of exogenous ketones, we are then providing the body an option to be in ketosis, even without the restrictive diet of keto diet or fasting. So you can still have glucose in your body, and then you have ketones via exogenous means. And that gives your body the sort of hybrid fuel situation where a lot of athletes are benefiting from it because it has glycogen sparing effect, it has recovery effect, and it has that cognitive benefit as well.
Let's step back a little bit on the endogenous ketones.
Sure.
What are the ways that the body creates the beta hydroxybutyrate?
So one of the main reasons why our bodies do not create, so one of the main reasons that inhibits ketogenesis, which is the production of ketones in the liver, is the increase in insulin. And as we all know, insulin is very sensitive to blood glucose level. So whenever we have blood glucose level that is high and that kickstarts the insulin secretion, then the production of ketones will be halted. So whenever we are low on glucose, and this is traditionally being achieved via either keto diet, where your diet consists of only 5% or less of total daily calories coming from glucose or carbs, or when you're fasting. So when you're doing those two things, your blood glucose level will be very low. So will your insulin levels be. And that's when you start producing your endogenous ketones.
Now, one of the things I've noticed in some of my patients, and I routinely check insulin levels, fasting insulin levels. I've had a lot of people that had very stable glucose levels, even down into the high 80s, that are producing excessive amounts of insulin. Will that interfere with that? I mean, because a lot of people focus on the glucose, but should the insulin also be looked at as a potential kind of obstacle?
I think it's the insulin that people should look at. I mean, glucose is an easier way to measure for sure. So that's why a lot of people, they say, if I have glucose in my body, I shouldn't produce any ketones. But ultimately, if you look at metabolism, it is the insulin that inhibits ketogenesis. So if there is a reliable way and cheap and cost-effective way to measure your insulin instead of your glucose, then that should be a more direct indicator on whether or not you are successful at producing ketones. Now, granted, there are certain cases, whether due to certain diseases, certain dysfunctions in the metabolism, or certain medication, that may also increase insulin or inhibit ketogenesis as well. So that is regardless whether or not you have high sugar in your blood.
Now, let's talk a little bit about the microbiota of the gut. Does that have an impact on the amount of ketones that are produced, or does it take up ketones? How does it play a role in this?
As far as I know, there is no studies right now that directly connects ketones per se with microbiota. There are studies that looked at ketogenic diet that helping with the gut microbiota and gut diversity, but I don't think we can draw any conclusions so far to say that ketones have a direct effect on microbiome and all of that, because as we all know, I believe microbiome is way more affected by the diversity of the food rather than just one molecule, right? So all the prebiotics, probiotics would play a bigger role compared to just having one molecule affecting the microbiome itself. So I think that's my take on it.
Yeah. Okay. Can you let's go into the exogenous ketones to get a little more information on that. What are the different forms of exogenous ketones?
Great question. And this is where a lot of people get confused as well, because there are so many exogenous ketones out there and everyone's marketing themselves as like, oh, this is ketones and ketones are ketones. But there are different forms. I think it's similar, when people market magnesium supplement. There's so many different types of magnesium supplements, right? Magnesium citrate, magnesium sulfate, all of that. So same thing with ketones. So as I said earlier, blood BHB or BH form of ketone that our body uses. So initially, I think the earliest form of exogenous ketones were the ketone salts. Ketone salts are essentially BHB molecule bound with a salt molecule. That could be magnesium, potassium, sodium. The problem with ketone salts is that it doesn't raise your blood BHB high enough to the level of inducing some form of cognitive or physical performance. And this has shown in studies, because they use ketone salts and they measure the blood ketone levels, it doesn't raise above 1 millimolar, and they did not see any performance increase. A lot of the studies that showed performance increase were using different other forms of ketones, and I'll cover those as well. So with ketone salts, and also in order to increase your blood pH, and when you have a very high dose of salt, what will happen? It will give you GI issues, and you'll start having, either diarrhea or vomiting or just feeling unwell in general. And then you have MCT, MCT oil. A lot of people use MCT oil with their ketogenic diet lifestyle to enhance the ketogenesis, and that is a fatty acid. It is not a ketone, but it does have a high probability of getting converted into ketones by your liver. That doesn't raise your blood BHB levels higher than 0.5 millimolar, according to studies. And then you get to the area of ketone esters. What are ketone esters, right? Ketone esters is essentially a fancy word of a chemical name of BHB bound to another molecule in an ester bond. And this molecule usually is butanediol. R13 butanediol, so BHB bound with butanediol in an ester bond. What happens when you ingest ketone ester is that the ester bond is cleaved in the gut. The BHB molecule goes straight to your blood, increasing your blood BHB.
BHB get into the blood through passive diffusion from the intestine?
I believe so.
Okay.
I believe so. And then, so that is why when you drink ketone ester, it does spike your blood ketone levels at a very fast pace. Like within half an hour, you are achieving like about 3 to 5 millimolar. And initially we thought that's great because ketone is good for you. So therefore, the higher your blood ketone, the better. Not until about 2 years ago, some studies come out and looked at blood acidity or blood pH levels. When you spike your blood pH too high, too quickly, what happens is that your blood pH drops and it creates a more acidic environment. And as a result, when you are exercising, you are increasing cardiorespiratory stress biomarkers, i.e., your heart rate, your breathing rate, because your body is trying to expel all the carbon dioxide within the body in order to neutralize the blood.
And, let's go into the different reasons people are taking the ketone esters. One of the reasons that we've used it a lot is in performance optimization. So for athletes with increasing their workout performance and their recovery. So can you talk a little bit about that aspect?
Yeah, sure. I think when we came out with the first ketone ester, that the work around exogenous ketones were very focused on performance and very focused on endurance specifically, because they're all the cyclists that are using it. We're looking at 2 to 5% improvement when using ketone esters. And then there are some recovery studies that improve work output by 15% after 3 weeks of using ketones for recovery strategy. We have seen glycogen sparing effect. We have seen decrease in lactate. We have seen increase in just performance in general, either time trial or work output. And we have seen in terms of recovery specifically, there is a leucine-mediated mTOR activation when taken after exercise together with proteins and carbs. We are increasing protein synthesis via mTOR activation. So that's great for recovery for athletes.
I do want to go into the cognitive and brain aspects of this, but back on the use in athletics, I mean, I definitely find that when I do a bottle of the Ketone IQ, my workouts, I perform much better, better recovery, better endurance for using in workouts.
Yeah, so this is interesting because a lot of the studies using exogenous ketones for workout, they are body weight matched, right? As you know, in science experiments, clinical trials, we try to standardize the dose as much as we can based on body weight so that there is no discrepancies where someone's bigger and therefore, they are having less of an effect if we just have the same dose for everyone. So in terms of body weight dosing, we are looking at between 0.3 to 0.5 grams per kilogram of body weight. But anecdotally, now we have a lot of athletes who are using Ketone IQ as their main source of fuel, especially fueling their competitions and races. We are talking about 1 or 2 shots of ketones, Ketone IQ, which are 10 grams or 20 grams, depending on, if you're a smaller person or you're a bigger person. And that's way lower than 0.3 grams per kilogram body weight. That's why I was saying, it's like nowadays we are seeing that the effect of ketones are there even when you don't have a huge dose where you reach like 2 millimolar. Like these people are reaching 1 millimolar with like 1 or 2 dosing, one or two servings, and they already see an improvement and they feel great.
Are they taking these servings at the same time, or are they staging it during their workouts?
So if you are taking, let's say if you are a 70 kilogram person or 100, maybe 150, 160 pound person, right? I would take two. I would take two of those little shots, or the 2 servings of the big bottle, which is about 20 grams of butanediol, half an hour before you start your workout. And then as you work out, if your workout is longer than 2 hours, I would top up at 90 minutes after you start your workout. So you get 2 hours in between the first dose and the second dose, and then top up every 2 hours.
That's good to know. That's something I've not read about. So
yeah, because I think it traces back all the way to the 2016 paper in Cell Metabolism by what's his name, by Kieran Clark's group. I did my PhD in that lab as well. So, but the main author's name escaped my mind right now. But what they have seen is that using ketone ester, they use dosing before, like half an hour before or 15 minutes before, and then topping up 90 minutes into the workout.
I will keep that protocol in mind for my clients
And
now. It's good to
one
have.
very easy way to measure as well, if you have a blood ketone meter, just measure your blood ketones after like 2 hours, and if it starts going down, measure it after you take it, half an hour after you take it, right when you want to start the exercise, you will see the increase. And then if it starts going down after 2 hours, then maybe it's time to top up. Or how you feel. So a lot of our athletes, they're so in tune with their body that they count on their instincts a lot, right? If they feel like they need energy, because especially if they're used to refueling with like the goo gel or whatever carb sources, then they know when they need to refuel. So when you refuel with like the carb sources, you might as well just refuel, have a shot of ketone.
Have you looked at like endurance races like an Ironman or a marathon where some people would use the simple goo, the sugar, versus people using ketones as their fueling? Has there been a difference in a study?
We haven't looked into a study per se that compares ketones and carbs versus carbs only versus placebo.
Mhm.
I don't think we've done that for long endurance races, but we have had a lot of athletes now who have done the races with ketones. And obviously, they have been in the circuit for a while, for many years, they've done it, and they report the difference. And in fact, like Ashley Paulson a few months ago won the Badwater for women and also beat the men's time. And she said, that was the best time ever. And she used Ketone IQ for the first time for that run.
Is there a difference between the utilization by males and females? Because I have heard that in like ultra endurance races that females are more efficient with using fat than males.
Yeah, I think that's what I have learned as well in terms of fat and glucose utilization, and that is especially true when you look at keto diet. Like keto diet are very different when used in males versus females. But as far as exogenous ketones are concerned, we haven't seen a drastic difference when used between males and females. I think it's because the amount that you're putting in, it's sort of the same. Whereas if you're talking about endogenous ketones, it's your body's own capacity and capabilities in producing the ketones and then metabolizing it. So assuming the ability to metabolize ketone would be the same, then if you provide the same amount of ketones into the body using exogenous ketones, then the differences should be minimal. But if the discrepancy falls into the capacity to produce ketones, I think that's when it amplifies the difference between males and females.
Let's shift gears to talk about the other use that I see quite a bit of, and that is in cognitive function.
Mm-hmm.
I find that I can get about 3 to 4 hours of greater clarity and focus when I use it, and it's similar to what I hear from a lot of my patients as well. You go into the effect on the brain.
Yeah, I think that is pretty accurate, and I use it myself, for podcasts. If I have a long day that I know I'm going to have packed with meetings, and then I have to write a grant application, for example, I'll have a shot or 2 shots before, and I'm good for 4 to 6 hours. I think the primary function of ketone being a preferred fuel for your brain, that really stands when it comes to cognitive benefit, because you can feel the subjective difference. And then in a study 2 years ago, they looked at brain network stability. And the way they looked at brain network stability is essentially the interaction between brain regions measured by functional MRI. And they have 3 arms. One arm is keto diet for 7 days. The other arm is exogenous ketones. So they use ketone in that study. And then third arm is placebo. For the exogenous ketone and the keto diet arm, they both saw an increase in brain network stability. So your regions, the different regions in the brain are talking to each other more versus placebo. And that's huge, because as we age, that brain network stability decreases, and that increases the risk of developing neurodegenerative diseases such as dementia and Alzheimer's.
Now, I know you also have a background in genetics, and one of the areas of interest I have is in the ApoE4 genotypes. Have there been any studies using the ketone esters and how it impacts that?
Not that I know of. I'm not aware of that. But it will be very interesting, especially looking at the signaling. And now we're moving back into the conversation around the signaling of ketones on a DNA level. And just because someone has a certain gene, it doesn't always guarantees that that gene is going to be expressed, right? So we're looking at different promoters, we're looking at different switches on and off of a certain gene, and that would certainly be a great experiment and great study to have for sure. But I think when it comes to Alzheimer's and neurodegenerative diseases, a lot of either funding or the researchers, they're more interested in the clinical outcome rather than the mechanism of action, because then they know it's like, okay, if it works with this population, this disease population, they can definitely help way more, than they can deploy much faster to help a much bigger population. Versus, if we look at an in vitro study or a genetic model study, yes, we will understand people like you and I would be very curious to find out what the mechanism of action is. But ultimately, there is also the translational side of the science into more applicable situations.
And you spoke earlier about the study with using the ketone esters and traumatic brain injuries. Can you expand on that a little bit?
Sure. So we, as I said earlier, we're looking at 2 different aspects of ketones that may help with traumatic brain injury. If someone has a concussion, what we have seen is that acutely the brain upregulates glucose metabolism. It really pulls in all the glucose. Some studies show that they're using the glucose for metabolism in general, because inflammation and all of that, and really provide energy for the brain. And then some other studies stipulates that the glucose is being shoved into the pentose phosphate pathway that is beneficial for the mitigation of the damage. And then weeks after that, they slowly slow down the glucose metabolism, and then they saw so that's a hypo metabolism of glucose, and then they saw an increase in lactate metabolism, showing that now the brain is like compensating with the hypometabolism in the beginning, and then now compensating with lactate. And so there is a form of energy deficiency, an energy deficit, when it comes to brain injury. And we think that ketones could potentially fill in the gap and compensate for the energy deficit that glucose can't provide during the acute setting. But also in the long run, when you have hypometabolism of glucose, ketone can also step in to really provide the brain with energy. And then the second aspect of ketone that we are very interested in looking at would be the inflammation aspect, where ketones have been shown to be anti-inflammatory. And this is especially important with both mitigation as well as recovery of TBI, leading into the increased risk, if not mitigated, leading into the increased risk of developing neurodegenerative diseases.
Now, I've been reading some interesting research on the ketone esters and the heart. Can you talk about some of the cardiovascular effects?
Yep. So there are some really interesting animal studies that looked at heart failure model, and we know just without any intervention, the failing heart does upregulate ketone metabolism. The postulation is the stipulation is that ketones are more efficient as a fuel glucose per oxygen used. So that has been shown in 1995 by a paper by Sato. And then later on, these researchers use exogenous ketones in animal models, in heart failure animal models, to look at the cardiomyopathy that follows a heart attack. So when you have a heart attack, there is damage done, and then usually there is a cardio hypertrophy where your heart enlarges to compensate for the dead tissue, so that you can sort of still pump the blood through your body. That hypertrophy and cardiomyopathy was mitigated when ketones were introduced, either before or after a heart attack. And recently, with University of Aarhus in Denmark, they saw preliminary studies in animals as well as humans that this might be beneficial for humans. So what we have done is we have collaborated and submitted another grant with them. They submitted the grant and to look at 250 heart failure patients. So a lot of really interesting work there. I think when it comes to cardiovascular disease, a lot of times is atherosclerosis, is ischemia, is the blockage of blood vessels, hence the lack of delivery of substrates into the heart, but as well as lack of waste going out. So you have the accumulation of waste and lactic acid and all of that. But a lot of times is the ischemia causing the energy deficit, right? You are essentially creating a situation where you have the lack of ATP generation, you have an increase in oxidative damage that leads to apoptosis and the damage that comes after. So we assume that, or we hypothesize that ketones will be a great source of fuel in that instance, even with ischemia, even with the blockage, that when ketones are present, it can mitigate the oxidative damage as well as providing enough energy for the heart to function.
Are there any downsides to ketone esters? Anything that would be a risk or something that people should consider?
So if we're talking about ketone esters, first and foremost would be the GI issues. I think in our military contract, in the official report as well, and that was done by an independent research institution, H.V.M.N, based in Florida, Pensacola. And they have seen with ketone esters, higher dosage increases occurrence of GI issues, nausea, diarrhea, all of that. So that is independent of the benefit that it may bring. That's why Ketone IQ, we believe that is a superior technology, because it produces the same benefits without the GI issues and without the side effect. If you are very prone to having hypoglycemia, you might want to monitor that on how you feel, how if you're fasting, if you are going through a keto diet, making sure that your blood sugar is not going too low to the point that you're getting all the jitters and getting cold.
I found I frequently wear a CGM, and I found that when I have a meal that's fairly starchy or quite a bit of carbs, if I do a shot of the Ketone IQ beforehand, it significantly blunts the glucose
That is
spike
correct.
that would normally occur for me with that.
Yep, and this has been published in about 3 papers, I think. There are 2 papers, one on healthy individuals, one on obese individuals, and then the third paper is like a 14-day study. And then now they are running a 3-month study to look at HbA1c and all of that as well. So this was done by University of British Columbia by Dr. Jonathan Little to show that exogenous ketones, and he used a couple of different exogenous ketones, and across the board, they all decrease blood glucose to a certain extent.
Okay, so what's the next great thing coming out of H.V.M.N?
I think for next great thing, like 2024, we will be looking forward to better flavor. I think that is something that a lot of people are looking forward to, especially on the consumer end. From this research and science end, we are looking at all these different studies actually taking off. Hopefully, fingers crossed, we'll get 1 or 2 of these grants, and that would then kick off more grant applications, because now we have more preliminary data to allow us to deploy it at a bigger setting, at a much larger multi-center setting for either TBI or cardiovascular disease, or even diabetes and obesity.
Well, it all sounds great. I do love the product for sure. I'm a frequent user of it, and I frequently direct my clients to pick it up as well. I have some people that don't have the types of responses that most of them do, but most do have a very positive response with exercise and cognitive function for sure.
And that's a great point as well, Daniel, that not everyone would react the same, right? Because we all have very, very unique bodies and very unique metabolism. And even in all our studies, out of 10, maybe 1 or 2 people will be non-responders, in which case they won't see their blood ketone levels increase. They don't feel well then when they drink it. It's not of the time that it will always work, because it's the same as anything else, any supplements you take, right? It will not work for 100% of the population, just based on the variability that we have genetically and metabolically. And another point to really point out is that while it is a great supplement, it's a great tool, it is also nothing but a tool, right? So you still need to make sure that your other aspects of lives, like your working out, your movement, your sleep, your stress management, your nutrition, are on point before augmenting or optimizing your lifestyle with these tools.
Yeah, I couldn't agree with you more on the foundational stuff, because I will not talk to people about optimizing something with a tool until they've got the sleep, the stress, the nutrition, the exercise, movement all dialed in, and they're optimal there. And then you can get the positive enhancement effects from the tools.
Exactly.
Well, it's been a real pleasure having you on. It was almost a self-indulgence, because I got to ask all the questions that I that I can't just call somebody up and ask. So thank you so much for sharing your knowledge. I look forward to what's next from H.V.M.N.
Thank you.
This podcast is for informational purposes only. The podcast is not intended as a substitute for professional medical advice, diagnosis, or treatment. You should not use the information on the podcast for diagnosing or treating a health problem or disease, or prescribing any medication or other treatment. Always seek the advice of your physician or other qualified health provider before taking any medication or nutritional, herbal, or homeopathic supplement, and with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this or any other podcast. Reliance on the podcast is solely at your own risk. Information provided on the podcast does not create a doctor-patient relationship between you and any of the health professionals affiliated with our podcast. Information and statements regarding dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to therein. If you think you have a medical problem, consult a licensed physician. This podcast is owned by Neurohacker Collective.